As a medical doctor, I'll confine myself to the relevance of telehealth, but specifically in the COVID-19 situation. All the time we are concentrating only on coronavirus. Please remember, when 100,300 million people are isolated, we also need to cater to non-coronavirus health problems. Now, it's going to be extremely difficult for a normal person to go to a hospital physically in this situation. And this is where telemedicine can play a very vital role. Number two, we also know that in our own country, in Thiruvananthapuram and Mumbai, etc., several healthcare workers, doctors, nurses, etc., have been isolated. If unfortunately we reach the situation where hundreds of doctors are isolated, this will have a major repercussion on the way healthcare is delivered. So remember that a doctor may be isolated or quarantined, but he is physically and mentally absolutely alert. A quarantine doctor can, through the telemedicine setup, screen as many as 100, 200, 250 patients over a day. So the telemedicine alone can do this. Thirdly, today with simple algorithms which have been devised everywhere, you can do a tele-triage. You give weightage for specific questions asked, and with a 95% confidence, you can clinically safely exclude the possibility of a coronavirus infection remotely. You can identify exactly the group which are suspicious and make them alone go to a laboratory or make the lab come to home. Finally, of course, that technology is just coming to India. A very detailed clinical examination can be done remotely. Today, we have thermal sensors, we have oxygen saturation, we have digital stethoscopes. Gone are the days when you need to place a stethoscope physically on somebody's chest. For the last 10 years, we have been doing this with a digital stethoscope. I have trained my patients to put the stethoscope on their own chest, and through the internet, a doctor at the remote end can listen to the heart sounds. So all these gadgets are available. So based on this, I can peer into the interior of the throat, I can look inside the nose, the ear, etc., from hundreds and thousands of miles away. But most important is in the milieu of social distancing, when we say we should not crowd, etc., telemedicine and telemedicine alone can be the answer to address a major pandemic like this.